Hydrocortisone can have interactions with other drugs, so if you're using other drugs, always ask your doctor if hydrocortisone is safe for you. Hey there, welcome back to How to Medicate and welcome to this video on how to use hydrocortisone. This video is part of a video series on your skin where we will cover all kinds of skin related problems and drugs. If you want to learn more, check out the playlist I made in the description. Now for those of you I'm meeting for the first time, my name is Raoul, I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because I believe that medically educated people make healthier decisions and that's what this channel is all about. Now this video also comes with a quick disclaimer. It's meant purely informative, this is not medical advice, and if you're looking for medical advice, always contact your own doctor. Now quickly, let's get started. Now the generic name of this medication is hydrocortisone, but it's sold under several brand names. Acecort and Plenadren. It's available as ointment, cream, tablets, capsules and injections. Now then, how do you use hydrocortisone? If you want to use the tablets or the capsules, swallow them whole with half a glass of water and make sure that you don't chew or you don't bite on them, because this can decrease their effectivity. In addition, it's best that you take them before or while eating something. This will lower your chances on stomach complaints. Now if you want to use the cream or the ointment, make sure that you don't apply it too thick, because this can increase the side effects you're experiencing. However, don't apply it too thin either, because this may decrease the effectivity. So how much should you apply? Always ask your prescribing doctor or pharmacist to show you exactly the amount you should apply. It's also important here that you wash your hands very carefully after applying the cream or the ointment. Make sure that it won't come in contact with your eyes. And for the first hour, make sure that the part of your skin where you applied it will not come in contact with water. Furthermore, take hydrocortisone at fixed times. This will make it less likely that you forget a dose. And as always, it's very important that you do not interrupt the treatment and you finish it completely. Now then, when can you use hydrocortisone cream or ointment? These are used for skin-related problems like eczema, severe itching, inflammation of the skin or an allergic skin reaction. The tablets, capsules and injections are used in the following cases. When someone has a problem with the production of his or her own corticoid hormones, in severe cases of COPD or asthma, and in severe allergic reactions. And this brings us to what dosage to use. And unfortunately, I cannot provide you with the correct dosage here, as it differs too much depending on the indication of use. For tablets and capsules, the dosages are individual. They are based on laboratory values and the symptoms you have as a patient. Regarding the ointment and the cream, as previously mentioned, you should ask your doctor how much and how often you need to apply it. Now, hydrocortisone is a very effective drug, but it can have some side effects. I will discuss the most common ones here, but if you want to have a complete list, check your leaflet or ask your pharmacist. Now, when using tablets or capsules, very commonly, so more than 10% of all patients will experience dizziness, a headache, diarrhea or fatigue, and commonly, so 1 to 10% of all patients will experience an abdominal pain, nausea, itching and a rash. If you're using the ointment or the cream, you may experience thinning of your skin, an allergic reaction where you apply the cream or the ointment, whitening of your skin, and it can cause various other skin-related problems. Now this brings us to the safety of hydrocortisone. It's safe to use with any type of food, you can combine it with moderate amounts of alcohol, and you can drive while using hydrocortisone. However, hydrocortisone can have interactions with other drugs, so if you're using other drugs, always ask your doctor if hydrocortisone is safe for you. Furthermore, if you're using this drug for a longer time, then it can have additional risks when you quit it suddenly or when you're exposed to a very stressful situation. Discuss this with your prescribing doctor. And as always, we will take a look at the safety of hydrocortisone when pregnant or when breastfeeding. And unfortunately, hydrocortisone can be dangerous in both cases. So if you're pregnant or breastfeeding, always discuss this very clearly with your doctor. Now as always, I hope you learned something, because that's the general point of this video. And if you want to learn more on skin related problems or drugs, check out the playlist I made in the description. Now before you leave, please like the video, this will help out the channel tremendously, and don't forget subscribing so you help me reach my new milestone, 5,000 subscribers. Thank you for watching, and as always, I will see you next week. Bye bye.